So contact tracing is important. We just are trying to get ahead of the curve. And when I say curve, I really mean the spread of disease. If we can find the people who have been in contact or close contact actually with people who have been diagnosed with COVID-19 or Corona, then that's a way to stop by putting them in isolation to stop the spread. The first thing we do is we actually ask them when they first started noticing signs and symptoms of COVID, and then we go through and we speak about exactly what signs and symptoms they are experiencing. That's important information to have to give back to the state so that we can just find consistencies in this disease. And then the next thing we go through is any pre-existing conditions, medical conditions that a person may have. And then we do 14 days from the date of onset, and we just create a timeline, and we want to know where they've been and who they've been in contact with, and we want to collect names and numbers of anyone that they may have been in contact with. The 14 days prior to the onset of symptoms is to try to figure out where they may have picked up the virus from, and then we collect any time that has passed from the date of onset of symptoms to the present to see if there's anybody that we should contact to let them know. Close contact currently is defined as somebody who has been within 6 feet of someone confirmed with Corona for 10 minutes or more, living in the same household, having an exchange of fluids. And so we only go back 2 days prior to the onset of symptoms and contact those people. That's considered the contagious phase of Corona at this time. That may change later, we don't know. So we contact all those people within the 2 days prior and to the present. Liz was great when I spoke with her. She gave me a very good timeline where she was, had great information. So I was able to contact those people when I was kind of putting together her timeline and trying to figure out where she got it. And then luckily, Liz really didn't have contact with very many people in the days that she was contagious. And so that was a relief as well to know that it had been kind of stopped and contained. So because Liz had been following the stay home, stay healthy order, it was controlled, and it made my job much easier. Somebody who's been confirmed will get a call from either in our county population health or from their healthcare provider, notifying them that they've been positive. In our county, we've actually been very successful in doing that and really lucky. And I think that's really helped keep our case count down. The process is when we get that information, we give them a call and I say, hey, we have information that you've been diagnosed positive with COVID-19. I need to do contact tracing. It's going to take about 30 to 45 minutes. Do you have that time? And people do. They're like, yeah, I'm sick. I have nothing else to do. Let's talk. So I just kind of explain the process to them. I'm going to collect information about your signs and symptoms, your pre-existing conditions, and then we're going to create a timeline. The timeline definitely is the most time-consuming process. If they don't answer, we're going to leave a voicemail. We're going to try multiple times. People are great. They answer their phones. The people in our community have been really cooperative. When we call, they have lots of great information about their whereabouts. And they're happy to share it. People who have been diagnosed with COVID-19, usually they start the process for us. They're contacting people that they know and they're like, hey, I've been diagnosed. You may get a call. And so that really helps me as a contact tracer. When I call somebody, they're already expecting a call from me. It makes my job so much easier.